Can medical cannabis help people with autism? Hi everybody, it's Dr. David with another Ask Dr. David episode. So this is a question that I do get asked with some frequency. People have been surprised that I can treat children with any child with medical cannabis in the first place. But as you may know, this is Autism Acceptance Month, and so I'm going to be focusing on autism. And to answer that question, it's undoubtedly the answer is yes. Now, of course, there is no single treatment out there that's going to help everybody. And if anybody says that they have the medical cure, I would advise you to run as far away from them as possible. Now, medical cannabis is not curing people with autism. Just like it's not really curing any other medical condition, but it can significantly alleviate some of the more debilitating symptoms that a person has. Okay, so as you may know, I specialize in medical cannabis. I'm also a board-certified pediatrician, and I'm one of the few board-certified pediatricians in the country who is considered an expert in treating children with medical cannabis. Now, in honor of the month, we're going to go into this a little bit of a deeper dive and explain a little bit of how it is that I'm able to help people. Okay, now, medical cannabis is probably one of the most consistent things that I have seen now that I've been using it for about 5 years in the autism world in terms of helping something out. Okay, it's not the first place that I'm going to go. And of course, there's a lot of people who come into my practice, especially in our holistic pediatrics and family care practice. This is not what they're looking for. As you may know, I also have a second practice called Holistic Relief, spelled RELEAF. Get it? And so, and of course, when people come to see us in that clinic, that is specifically what they're there for. So if you ask how many people who come into my holistic relief clinic who have autism get treated with medical cannabis, the answer is everybody, because that's why they're there. The answer is for a much smaller number, though, for my general practice and for the overall number of patients that I see with autism. Okay, so some of the debilitating symptoms that I have seen significantly be reduced: irritability, anxiety, hyperactivity, insomnia, pain, panic attacks, poor sleep, violent behaviors. Okay, some of the most debilitating things that can help with, and I've seen all of these things show remarkable improvements in some of our kids. In fact, I'd say a very good, probably over a majority of them. It's a strong number. Now, one of the things is how versatile cannabis is, because there's lots of ways that people can take it. Of course, people are aware of smoking pot, and that's, of course, not what we're talking here. Children aren't allowed to get from the dispensaries actual flower, actual buds until and a patient can't until they're over 18 years old. So that's not really an option. That's not what we are doing here. There are tincture forms, which are drops. There are food-based products that are like gels and hard candies and brownies and cookies. So different types of what are called edibles. There are capsules, and there are other inhaled ways that they can do it. There is a meter dose inhaler, like an asthma puffer, that when you attach it to a spacer and they just put the mask on, and they'll breathe it in like that. And there are a fair number of families who are comfortable and who have taught even some low functioning as well as younger kids how to vaporize. I want to make a quick note about that because, of course, in simpler times before COVID, if you remember the summer before, there was the concern about vape lung injuries. It turns out that all of those products were illegal products that were being laced with a form of vitamin E oil that has the same consistency, thickness as cannabis oil, and that way it would be used to fool the consumer. And it turns out that although people have obviously used vitamin E for lots of health issues over the years, nobody had ever burned it into their lungs before, and it turns out that it burns the lungs and it can cause massive scarring of the lungs. But of course, that cannot happen in products that are legal, that are purchased through state dispensaries, especially here in Florida, because they all have to be third-party independently tested. And if a product says that it's supposed to have 50% THC in it, in a vape oil, and they test it and it's only 25%, they know that something's going on there, and these companies wouldn't even risk it because they would lose their license, they would lose their businesses. So I do feel very comfortable that when people are using inhaled products such as the vape pens, cartridges, etc., that they get from a legal dispensary, that they're getting something that's not going to hurt them. Okay, now one of the main advantages also of inhaling it is the rapid onset of it working, relief of the symptoms. within sometimes 30 seconds, a minute, within 5 minutes for sure. And that can be incredibly helpful for some people with autism, especially if they're in the middle of an anxiety attack, a panic attack, a violent moment. Or if a child or a young adult, or any adult for that matter with autism, sorry, I always kind of say kids because I'm a pediatrician. If there's a transition, if there needs to be a need for a stop that they're supposed to, or somebody's coming to visit that they're not expecting, and you don't necessarily have the time because oral products do take about an hour, give or take, to kick in. But if there's an unexpected need for it all of a sudden, that's where the inhaled version can be helpful. But also, very much I want people using oral forms because so often when that is done, they never escalate into those moments where they need to have some emergency break glass type of treatment available to them, which is what the inhaled is as well. Now, another thing, you've probably heard me talk about how there's many other types of cannabinoids besides THC. CBD, that's one everybody's, of course, heard about. There is CBG that often works in synergy with CBD that is very good for anxiety, for depression, panic attacks, for pain. And then there's also CBN that can have calming effects, but also works really well for sleep, keeping people asleep so that they're not waking up early, being able to fall asleep in the first place. I do find a lot of times that it works especially well in synergy with THC as well. But of course, I first want to try these other forms, especially in children, before I move on to THC. Now, THC itself, of course, is not something that's been well studied in children. Of course, we're not just giving THC to somebody. We're giving it to kids who have been through other forms of medications and treatments and have not been successful. Kids who I've seen who they're one step away from being institutionalized if you put into a group home or something. So again, we're talking about treating who are significant people who are significantly impacted. Might it be impacting their cognitive function later in life? Of course, it could be, but so is autism as a condition in and of itself. So again, we try to be sparingly with it. Thankfully, CBD lowers and can sometimes even completely stop the intoxicating potential of THC. Another reason to use CBD before bringing in THC, because I have kids who are using doses of THC that really would get a grown adult way high, and they're not because they're using CBD. So anyways, just wanted to give you all a little primer on how I'm using different forms of medical cannabinoids, different ways of taking it, etc. If you want to hear more about autism in general, being that it is Autism Acceptance Month, where we're not just trying to make people aware of it, but we're trying to figure out ways to have people with autism and their families more involved in our communities, in our lives, how to give them lives, how to give them a community that they don't feel so ostracized or so closed off to the real world or are scared to be interacting with the real world. So if you so please seek us out on there. Of course, if you haven't yet subscribed to our channel here, please do so. Please hit the notification button. Please join us on our Patreon page if you want to be a patron and support us with what we're trying to do. Have a nice day.